Imagine waking up one day and realizing that the world around you no longer makes sense, that the voices you hear, the images you see, and the beliefs you hold feel as real as anything else, yet everyone else insists they aren't there. This disorienting and often terrifying experience is what we call psychosis, a mental state in which a person loses touch with reality. Psychosis is not a single disease, but rather a symptom, a manifestation that can emerge from a variety of mental health disorders, medical conditions, or even extreme stress. It is a condition that has fascinated and frightened humans for centuries, often misunderstood and stigmatized, yet it is much more common than most people realize. Psychosis can affect anyone, at any age, and the impact it has on a person's life, relationships, and daily functioning can be profound, but with proper understanding and treatment, recovery and meaningful life are entirely possible. At its core, psychosis is characterized by two primary features: hallucinations and delusions. Hallucinations are perceptions of things that are not actually present. Most commonly, they are auditory, meaning the person hears voices that no one else can hear. These voices can range from a single calm voice offering commentary to multiple voices engaging in conversation, giving commands, or even issuing threats. Visual hallucinations, although less common, can be equally distressing, manifesting as shadows, figures, or images that the person perceives as real. Hallucinations can also occur in other senses, including smell, touch, and taste, though these are rarer. Delusions, on the other hand, are fixed false beliefs that remain resistant to reason or contrary evidence. A person experiencing delusions may genuinely believe that someone is plotting against them, that they possess extraordinary powers, or that they are responsible for catastrophic events. These beliefs are often deeply personal and can dominate a person's thoughts and behaviors, sometimes leading to dangerous or socially isolating actions. Psychosis is not just about hallucinations and delusions, though. It also profoundly affects thinking, emotion, and behavior. Disorganized thinking is common, where thoughts jump erratically from one topic to another, making speech difficult to follow or understand. A person might invent words, create new meanings, or string together unrelated ideas, leaving listeners confused. Motor behavior can also be abnormal, ranging from agitation and repetitive movements to catatonia, a state in which a person may remain immobile or unresponsive for long periods. Beyond these obvious symptoms, psychosis often carries what are called negative symptoms, features that involve a reduction in normal functioning rather than an excess of abnormal experiences. These include diminished emotional expression, reduced motivation, social withdrawal, and a decrease in speech or initiative. Negative symptoms can be particularly challenging, as they often persist even when the more overt psychotic symptoms have been managed, significantly affecting a person's quality of life. The causes of psychosis are complex and multifactorial. Mental illnesses are the most common underlying factor. Schizophrenia, for example, is a chronic disorder in which psychosis is a defining feature. Individuals with schizophrenia often experience a combination of hallucinations, delusions, disorganized thinking, and negative symptoms over long periods. Psychosis can also occur in mood disorders, such as bipolar disorder and severe depression, where it is typically mood congruent, meaning the content of delusions or hallucinations is related to the person's emotional state. Substance use is another significant trigger. Drugs such as cannabis, amphetamines, hallucinogens, and alcohol can precipitate psychotic episodes, either acutely while under the influence or during withdrawal. In some cases, psychosis arises from medical conditions, including neurological disorders, infections affecting the brain, traumatic brain injuries, or metabolic imbalances. Even severe psychological stress, trauma, or life-changing events can act as catalysts, particularly in individuals who are genetically or biologically vulnerable. Diagnosing psychosis requires careful evaluation by a trained mental health professional, typically a psychiatrist. There is no single laboratory test that can definitively confirm psychosis. Instead, diagnosis relies on detailed clinical interviews, observation, and ruling out medical conditions or substance-induced causes. A thorough history is essential, including the onset, duration, and nature of symptoms, as well as personal and family psychiatric history. Understanding the context of the individual's life, stressors, and social environment is equally important, as these factors can shape both the manifestation of psychosis and the strategies most likely to help. Early recognition is critical, as untreated psychosis can worsen over time, leading to severe functional impairment, social isolation, and in some cases, self-harm or harm to others. Treatment of psychosis is multifaceted and typically involves a combination of medications, psychotherapy, and social support. Antipsychotic medications are the cornerstone of treatment. These drugs work by modulating the effects of neurotransmitters in the brain, particularly dopamine, which is believed to play a key role in the development of psychotic symptoms. While medications can be highly effective in reducing hallucinations and delusions, finding the right drug and dosage often requires careful monitoring and adjustment, as side effects can vary widely from person to person. Beyond medication, psychotherapy is crucial for helping individuals understand their experiences, develop coping strategies, and rebuild confidence in their ability to function in daily life. Cognitive behavioral therapy, or CBT, has been shown to help individuals challenge delusional thoughts, reduce distress from hallucinations, and improve problem-solving skills. Supportive therapy, family education, and social skills training further enhance the recovery process, enabling individuals to reintegrate into their communities and maintain meaningful relationships. It is important to understand that psychosis is not a hopeless or permanent condition. With early and consistent intervention, many individuals recover fully or experience significant improvement. Some may continue to have intermittent symptoms, but with ongoing care and support, they can lead productive, fulfilling lives. Recovery often involves more than symptom management. It includes rebuilding trust, social connections, vocational or educational pursuits, and a sense of identity that is not defined solely by the illness. Communities, families, and healthcare systems play a vital role in providing support, reducing stigma, and fostering environments where individuals with psychosis are not marginalized or feared. The experience of psychosis is deeply personal and varies widely among individuals. For some, it is brief and transient, triggered by stress or substances, and resolves with treatment. For others, particularly those with chronic conditions such as schizophrenia, it can be a long-term journey, with periods of wellness interrupted by episodes of psychosis. Importantly, psychosis does not define a person. People experiencing psychosis are as diverse, creative, and capable as anyone else, and with understanding and support, they can achieve remarkable resilience. Public awareness, education, and empathy are essential in changing the societal perception of psychosis, which has historically been shrouded in fear and misconception. By recognizing psychosis as a medical condition that deserves care rather than judgment, we can foster a culture of inclusion and hope. Understanding psychosis also involves appreciating the subtle early warning signs. Many individuals experience what are called prodromal symptoms before full-blown psychosis emerges. These may include mild perceptual disturbances, unusual beliefs, social withdrawal, declining academic or occupational performance, or changes in mood and sleep patterns. Recognizing these early indicators allows for timely intervention, which can prevent the progression to more severe psychotic episodes. Prevention and early treatment are not just clinical priorities, they are deeply humane, helping individuals avoid the social, emotional, and occupational disruption that often accompanies untreated psychosis. Research into psychosis continues to evolve, offering new insights into the biological, psychological, and social factors that contribute to its development. Advances in neuroimaging, genetics, and neurochemistry are shedding light on how brain structure and function relate to psychotic symptoms. At the same time, psychosocial research emphasizes the importance of environment, trauma, and social support in shaping the course of psychotic disorders. Emerging treatments, including novel medications, digital therapies, and community-based interventions, hold promise for improving outcomes and quality of life for those affected. The future of psychosis care is moving toward integrated, personalized approaches that combine scientific rigor with compassion and patient-centered care.